Okay, I want to go over with you a bag technique. When I talk about a bag technique, this is the correct way to carry in your bag and make sure you don't cross-contaminate things from one client to another, okay? So, I want to say that with your bag that you carry in, I have seen some home health aides and nurses that their bags are bulging. They have everything but the kitchen sink in that bag. And that really, you're asking for trouble. You should have some boxes, totes in your trunk in your car, a clean one and a dirty area. That's where you keep your extra supplies. You only carry in with your bag what you need for that client specifically. Okay? So, your bag, if it does not have wheels, does not go on the floor at all. No wheels, no floor. Okay? So, you come into the home, you absolutely, when you walk in that door, you hand sanitize. Now, your bag will have 3 main compartments. The first compartment is called the dirty area. Now, nothing in there is really dirty, but we call it the dirty area because it's an area you can access without sanitizing your hands. So the first thing you're going to do is get out a barrier and put it down so that you can set your bag on it. Okay? Now you get out 2 more barriers and you place one. I like to place one on each side of my bag because that helps me keep it separated. One side is for the dirty and the other side is for the clean, and I really don't think it matters, just so you keep them separate. Okay, now in the quote dirty side, we again have the barriers, and then we have hand sanitizer and some antimicrobial soap. Okay. I also keep a garbage bag, just a little trash bag at all times. Now, I have heard some places that are not providing barriers, and if that is the case, these are doggy doo-doo bags. I know that's weird, but I really like to use them. You can just pull them out and put it down, and you can use that for your barriers. And I also like them because it never fails when I'm ready to leave a client's home. There's always a little something I forgot, a piece of trash or something, and I can just put it right in here and throw it away. Not only that, but sometimes your clients don't always have trash bags. You see a lot. You see a lot of different settings and things. So I always just carry these. They come with a nice little clip, and I can put them on the side. That's up to you though. Okay, now I have this barrier for my bag. I have a clean and a dirty side. The other 2 compartments on my bag, this compartment would be either for my laptop or for my paperwork. And you don't bring everybody's paperwork in, just client-specific paperwork. If you're not in this section of your bag, you keep it zipped. Always keep your bag zipped. You want to keep it clean. Okay, then I have the clean section of my bag. I do not access this until I hand sanitize. This is considered the clean section. So now that I have my barriers down, I'm going to go ahead and pull out my hand sanitizer and soap and put them down. Now, it's okay for me to use hand sanitizer most of the time. When you use your hand sanitizer, you rub until it is all dry. You don't wave your hands in the air until it dries. You give friction in all areas until your hands are dry. Okay? Now, when you should use the soap definitely is when they're visibly soiled, they're sticky, things like that. Otherwise, the hand sanitizer is considered okay. All right, so I've sanitized my hands. Now I'm going to enter the quote clean area of the bag. So I'm going to unzip, and as you can see in here, I have all my equipment for doing vital signs. I'm going to put these out. Now these are clean because I cleaned them from my last client. Every time before I put them back in here, they have to be cleaned. And you always start from the clean to the dirty. So that would mean that if I was cleaning my stethoscope, I started with the earpieces and moved down to the bell. Get another one, start with the earpiece, move down to the bell. Okay? And I have to do that before I can put them back into my bag. The same thing with this. I would start the cleanest and go to the dirtiest. Okay? And I'd need to do that before I put it back into my bag. All right. So that is your bagging technique. So let's recap to make sure you remember. There's a clean and a dirty side, and then a documentation component in your bag. The dirty side is going to have your barriers, hand sanitizer, and your soap. And on the clean side, you're going to have your vital signs equipment, your gloves, your wipes, and so forth. They are clean because you cleaned them before you left your last client's home, and they will be cleaned again before you enter them in. When you take things out of a section of your bag, you zip it back up again. Okay? And that is your bag technique for home health.